We are also taking the significant step of implementing a vaccine policy for certain sectors. I can't stress enough how significant of a step this is. Specifically, for some sectors that deal with our most vulnerable, the sick, the elderly, and the very young, we are introducing a mandatory vaccine policy. Minister Thompson will share the details, but I can tell you it will include healthcare workers, long-term care and home care staff, paramedics, and teachers, to name just a few. Simply put, our vaccination rates are not high enough, and we need to protect those who can't protect themselves. People have had ample opportunities to get vaccinated, but there are still too many people who are choosing not to protect themselves and others. We know that there's a very small percentage of people who can't get vaccinated. There will be a process for you to prove that. But for the rest, the time is up, and there will be a clear choice before you.
While our vaccination rates are very good, we are in the midst of a fourth wave, and the reality is this. We need everyone to be vaccinated to protect our most vulnerable citizens, our healthcare system, and our economy. We have about 60,000 Nova Scotians who have chosen not to get vaccinated. These are the people at highest risk of carrying the virus, getting sick, passing the virus to others, and jeopardizing finite resources in our healthcare system. That's why we are implementing a vaccine mandate for some sectors in Nova Scotia. The new vaccine mandate will apply to those who work with our most vulnerable, including the elderly, the sick, and the children who cannot be vaccinated. This includes employees of the Nova Scotia Health Authority and IWK Centre, employees of long-term care facilities and home care agencies, paramedics and other EHS staff, Hearing and Speech Nova Scotia, public school teachers and other school-based staff, residential facilities and day programs funded by the Department of Community Services Disability Support Program and certain other facilities, and physicians and other service providers to the above organizations. These individuals must show proof of vaccination. If not fully vaccinated, meaning 0 or only 1 dose, they must participate in an education program, and they have until November 30th to become fully vaccinated. If an employee is not fully vaccinated by November 30th, they will be placed on unpaid administrative leave. Government will not provide additional funds to these sectors to pay for these administrative leaves. This is not a decision that government has made lightly. This is a step we did not want to take, but some of the new cases have demonstrated to us that those who are unvaccinated are placing others at unnecessary risk, especially our vulnerable Nova Scotians.
It may appear to some that we're in a whole new pandemic here in terms of it's not the same old pandemic, because they'll look at it and they'll say, well, look at all the people that are vaccinated, yet the measures they're bringing in seems even more strict than at the height of last year. Talk about that. There's a bit of a disconnect there.
So,
would you explain that to people?
So I would disagree. We're not using the strong measures that we had to use in Wave 3, in Wave 2, where we shut things down. We had to put significant limitations on the number of people that could get together. We had to close down various business sectors. We are keeping masking. We're keeping limits on informal gatherings, so that's where vaccinated, unvaccinated people to get together. But we're substantively opening up by removing gathering limits, by removing physical distancing requirements. That will have a significant impact on gyms, on restaurants, on all sorts of arts, cultural, sports events that are back to full capacity, the capacity they could have before COVID. So we need to recognize that we're actually in a very privileged position in Nova Scotia because of what we've done in the last 19 months. We can continue to open up, not as much as we perhaps would hope, but we can still continue to open up with the layer of a proof of vaccination policy in place, while other jurisdictions in Canada are shutting back down again.
I guess I was actually referring to the mandatory steps that you're taking. There were other mandatory steps before, obviously, but there's mandatory steps now that people talk about their freedoms. And a lot of people say that you're overreaching given the fact that you've got so many people vaccinated. I wonder, can you speak to the importance of why you've think you still need to do that?
So it's simply the Delta variant. It's highly infectious. It spreads very easily. And you need a very high level of vaccination coverage. The experts have said that we need, 90% of the eligible population needs to be vaccinated. We're close to that with at least one dose of vaccine. We're getting closer with 2 doses of vaccine, but we still have more work to do. And that all you have to do is look across Canada and what happens when you open up. Without getting that very high level of coverage. And I would disagree that people are saying we're being too tough. We're telling people that we need to look after each other. Right now, the way we look after each other, the main way in a pandemic is to get vaccinated because that protects everybody else around us. And I'm sorry if people don't like that. But you have an obligation to care for your neighbor. Care for the healthcare worker who's going to be there for you if you get sick. I won't apologize for having to take these strong measures to get to the level of safety that we need to have.